I'm Dr. Jovita, medical oncologist from Chennai. There's a common problem that chemotherapy patients face. Right after chemotherapy, there is an apprehension. What should we do? Are the things that we are doing right or wrong? So, these are some of the instructions that we generally inform all chemotherapy patients and those who are on immunotherapy or targeted therapy or any form of high intensity treatment. Now, we all request them not to go to crowded places, to avoid handshaking with people outside or even friends. We request them to wear masks all the time, and we ask them not to use public toilets or toilets which are used by many other people because they are at a very high risk of urinary tract infections, especially women because they have short urethra. They should avoid visiting sick people, and they should avoid unnecessary visitors, especially when there is a chance that others could have a flu or a cough, they might contract the infection. We advise them not to delay any cycle or to skip any cycle, and to inform their doctors as to this, whatever is the reason why they are delaying, whether they can delay or not. Oral hygiene is extremely important. During chemotherapy, the mucosa is soft and tender, especially when patients are on concurrent chemo radiation for head and neck cancers. We request them to use ultra soft toothbrushes, no smoking and drinking alcohol whatsoever, no tobacco chewing, and any kind of warning signs, especially in the first and the second week after chemotherapy. Like, for example, if there is a spike of fever more than 100 degrees, or extreme tiredness, or loose stools, vomiting more than 4 times a day, any other untoward symptom like excruciating body pain or anything that is, you know, unexpressible and inconvenient, they have to report to their treating physician. An often asked question is that, these patients come and ask us, Doctor, can I take my diabetic medications? Can I take my hypertensive medications? The answer to that is please do not stop the other medications for other comorbid conditions because they are extremely crucial. If the sugar and the BP is not under control, if the lipids are not under control, then it is a trouble when we give chemotherapy and other targeted agents. Therefore, whatever are the other adjunct medications or the main the medications that are prescribed by the other physicians, please do continue. However, it needs to be reported to the physician, the oncologist who is seeing the patient, so we know that there is if there is any interaction with the chemotherapy drugs, it is addressed, or if there is any titration that needs to be done on the drugs, right? Whether increasing the dose or decreasing the dose, that can be done. How about diet? Doctor, I do not know how to eat. I'm having sambar sadam. I do not know what next to eat. This is a very common problem that we face. We advise the patients to take adequate fluids. Fluids, when we say, it constitutes water, almond milk, coconut milk, tender coconut, buttermilk, all these put together. Definitely, it should reach 3 liters or sometimes even 4 liters, especially when some of the chemotherapies like platins are used, like cisplatin or carboplatin. It is essential that they are well hydrated. Food should be well cooked. Uncooked foods are not to be taken. So, how do we exactly have the cooked foods? So, try to cut down on the spices and the salt and oil. That is very important. The next is vegetables, fruits, and eggs. It should be had in adequate amounts. There are a lot of vegetarians who don't take any non-veg or even eggs. That's okay, but make sure that the protein intake is adequate enough. Now, how do we wash the vegetables and fruits? A lot of oncologists do say, don't take any fresh fruits. It's a big myth. Why that happens is because some of the patients, they don't clean the fruits well, especially the thin wall fruits, and once they have juice out of that unwashed fruits, they get gastroenteritis. So that is the reason why some of the doctors, especially the oncologists, when the patients are on chemotherapy, say no to fruits and vegetables of this kind. But the ideal way to consume these fruits and vegetables will be to wash them in lukewarm water with salt or vinegar or turmeric, clean them up extremely well, and then dab them dry, maybe with a towel, a kitchen towel, and cut them with clean knives and use them in mixies or grinders which are extremely clean. The blenders and the mixies jar, they have these blades, and many times the maids and the helpers do not clean them well, and that's when we make juice out of them and smoothies out of them, patients get into problem with gastroenteritis. So it is essential that we make sure that the cleaning of the jars, the blenders and the mixies is extremely taken care of. How do we do that? A little bit of warm water with maybe salt. Before and after the usage of the mixie and the blenders, we could actually run them a bit for 30 seconds and wash them out. Avoid raw and uncooked food. It is extremely important to keep that in mind, that we should not entertain any food that is uncooked. Even the leftover food that is there in the fridge, we should not entertain that. Meat and fish, oysters and crabs and prawns, they have to be well cleaned, especially the prawns. It has to be deveined and make sure that they are well cooked so that there is no gastroenteritis that happens for these patients who are on chemotherapy. The reason why I'm insisting on this is because these patients who are on chemotherapy, they tend to have lower counts. So when the total count goes down, there is a high chance that infection can be lethal to the point to which it can cause even mortality. That is why we are extremely strict about this particular fact of cleaning and washing and preparation of the food. Cold meats, sausages, sushis, salamis, pepperonis, and all these kinds of exotic preserved foods, processed foods. Try to restrict coffee intake. Maybe one coffee a day should be fine, because unnecessary coffee and tea intake, theobromine and caffeine, can cause heartburn. Raw nuts, it should be avoided. Better that nuts can be either sauteed or it can be soaked overnight before the patient is able to take it. The other thing is, in South Indian families, they get tender coconuts from the outside. They cut the coconut with something called as an aruva. So what happens here is, they do not sanitize when the outsiders in the roadside use these big instruments to cut the coconut. So we have to make sure that we can actually just slice it, come back home, wash it on the top, and we can actually make the hole to take the tender coconut out. I think that is a safer way to get the tender coconut. Patients who have chemotherapy often come with this complaint of change of taste, dysgeusia. So they have they take in less food because of this one particular complaint, and their appetite is lost because they don't feel anything tasty. So what is the way out? They have to have small, frequent foods, maybe 5 times a day or 8 times a day, instead of taking 3 times a day. And suppose the intake is going down, we could also suggest to them that we can more of soups, smoothies and salads which are cooked rather than uncooked. For those patients who have diabetes, I recommend that they should avoid white rice. It is better that they prefer to eat quinoa, brown rice, black rice, ragi and millets of different kinds, sorghum and jorghum also. In the South Indian diet, it is very popular for us to have idlis and dosas. They can make batter out of millets or sorghum or jorghum that is soaked overnight, and with that they can make dosas or idlis, and they can have a protein-rich diet. And those who have hypertension and those who have kidney disease, it is imperative that they have restricted salt intake. So whenever these patients are on like Siddha medicines, Ayurvedic medicines, they have to be revealed to the treating physician, because some of these medications can cause deterioration of other organs, like for example it can cause kidney failure or liver failure. Therefore, we have to make sure that the physician is informed about about the fact that they are taking these medications. Better that we avoid these medications because it will cause counteractions with the chemotherapy. We try as much to ask the patient to be active, because when they are active, there is no stasis of the blood in the lower limbs. But if they are not active, what happens is that there can be clots which can ascend up and it can cause heart attack or stroke. So we try as much to tell these patients to be active, or sometimes if they are immobilized, they can even be fixed with some floatrons and other things, so that the muscles are in action and clots don't form. Patients who are on chemotherapy, we make sure that they try to avoid shaving or tonsuring, because that can cause some infection. Therefore, we try to recommend them to use trimmers. Those vegetarian patients who have difficulty, who will not be able to take non-veg foods, should increase their pulses and legumes, so that their intake is increased. Along with that, they can also take a little bit more of garlic and ginger, so that the digestion is not affected and they are able to, cut down the bloating that they can possibly have. For non-vegetarians, it is better that they cook the food either by steaming it or by baking it, but not frying, because frying has a lot of oil content in it. Even if they want to have non-veg, some patients cannot have even non-veg foods well. So what do? We can even steam them and blend the non-veg food and give it to them as a soup. If they follow these instructions, that they will do very well. I hope to see you in another video with more such information.